would like you all to take a moment and think about your first job. Think about how you worked all those hours and how excited you were to get your first check. You had all these plans on how you were going to spend that money. Now, think about just how disappointed you were when you saw the total amount on the first check and how much less it was compared to what you had originally anticipated, thanks to taxes. Benjamin Franklin once said that the only two things that were certain in life were death and taxes. Now, the truth is that taxes are a part of life, but they do contribute to good causes and help to fund government programs such as public assistance. As college students who are working toward your degree and soon to be entering the workforce in your new career, shouldn't you have a say in how your hard-earned tax dollars are spent and what government programs you're helping to fund? Most of the careers you're pursuing will require you to pass drug, alcohol, and nicotine tests. So shouldn't the same testing be mandatory for all applicants of public assistance benefits in the state of Michigan, since these are often funded by those very same tax dollars? In my opinion, the answer to this question is yes. Drug, alcohol, and nicotine testing should be mandatory for all applicants of public assistance benefits in the state of Michigan to save tax dollars, prevent drug use, and to decrease discrimination. As a medical assistant for over 12 years, it has been a requirement upon employment for me to be subject to passing drug, alcohol, and nicotine testing at every facility I've worked at. This is standard practice for most jobs in the medical field, as well as many other working class employment opportunities. I have also been a recipient of both food stamps, WIC, and Medicaid insurance program benefits. I believe these factors, combined with extensive research on the topic, have provided me with enough experience and education to make me an expert on this matter. So, first we will discuss how tax money contributed to public assistance programs will save tax dollars. Next, we will discuss how testing will prevent drug use among low-income families. Finally, we will talk about how testing provides equal standards and less discrimination among both working class and public assistance beneficiaries. Drug, alcohol, and nicotine testing should be mandatory for all applicants of public assistance benefits in the state of Michigan to save tax dollars, prevent drug use, and to decrease discrimination. Tax money contributed to public assistance benefits will be saved and spent wisely on those who truly deserve it. Daily, I see many patients who receive public assistance and openly admit to smoking a pack of cigarettes a day and doing drugs. The average cost of a pack of cigarettes in Michigan for 2019 is about $6.44. If someone smokes a pack per day, this equals $193.20 every 30 days. That is almost $200 per month that could be used for groceries, housing, utilities, or other bills. Seasoned writer, educator, researcher, and author of the 2015 website article Pros and Cons of Drug Testing Welfare Recipients, Crystal Lombardo, argues, by removing drug abusers from welfare programs, there is the potential of being able to save millions of dollars every year. This is because drug use while on the program is specifically against the agreements that are signed to receive the government benefits in the first place. So what's the good of having a policy of requiring abstaining from drugs if it isn't even enforced? Since we have discussed how tax money contributed to public assistance programs will be saved, we can now move on to how testing can minimize and even prevent drug use. Testing can prevent drug use among low-income families. Preventing drug, alcohol, and nicotine use provides healthier parents with less chances of overdose, less drug-related heart conditions, cancers, and emphysema, which in turn will provide cheaper health care due to reduced doctor's visits, hospitalizations, ER visits, and reduced prescription medication costs. In reference to the 2015 article, The Cost of Substance Abuse to America's Healthcare System, Report 1, Medicaid Hospital Costs from the Center on Addiction website, the report found that any health reform that hopes to offer care to all Americans at a reasonable cost must mount an all-fronts attack on all substance abuse, involving both legal and illegal drugs. Now that we have considered how testing can prevent drug use among low-income families, we can change our focus to how testing provides equal standards and reduce discrimination for both the working class and welfare recipients. Testing provides equal standards and less discrimination among both working class and public assistance beneficiaries. While some might argue that mandating drug screening for public assistance applicants is a form of discrimination, I must argue instead that most working class individuals are already subject to the screening, so not testing applicants in the same way is actually discrimination against the working class. Others who oppose the policy change claim that the children of the applicants who fail their drug testing are actual victims and will suffer the consequences. But according to the NCSL website 2017 article, Drug Testing for Welfare Recipients and Public Assistance, NCSL Group Director and Director of the Indiana Institute for Working Families, Rochelle Finzel, states at least 15 states have passed legislation regarding drug testing or screening for public assistance applicants or recipients. And the requirements often do not affect the eligibility of a child in a home where the parents test positive. However, a family member or other designated person who has also passed a drug test is required to be the protected payee for the child's benefits. Okay, so let's recap. First, we discussed how tax money contributed to public assistance programs will be saved. Next, we discussed how testing can prevent drug use among low-income families. Finally, we talked about how testing provides equal standards and less discrimination among both working class and public assistance beneficiaries. Drug, alcohol, and nicotine testing should be mandatory for all applicants of public assistance benefits in the state of Michigan to save tax dollars, prevent drug use, and to decrease discrimination. The point that I'm really trying to make here is a matter of equality. So what does equality mean to you? Everyone should be treated equally regardless of financial situations, right? No discrimination. Well, if that is truly the case, then if you were required to pass a drug, alcohol, and nicotine test in order to obtain a job, then shouldn't those same standards be applied to those that seek public assistance that is funded with those taxes that are taken out of your check? So, let us stay true to our meanings of equality. Let us treat everyone the same. No discrimination.